So welcome everyone. Today I will be discussing a few of the commonly asked instruments in the grand viva of the ENT examination. So coming to the first instrument, this is lax tongue depressor. So this instrument is used to depress the tongue while examining the oral cavity and to see the posterior pharyngeal wall. So while using this instrument, it is important to remember that we only stay up till the anterior 2/3 part of the tongue, because that is the region where chorda tympani nerve supplies. Whenever we reach up to the posterior 1/3, which is the supply region of the glossopharyngeal nerve, the gag reflex will be initiated, and so it will be difficult to examine the oral cavity. So an important use of the lax tongue depressor that you must remember, and you are often asked if you can properly identify the instrument and answer the basic uses, then you are sometimes asked about the cold spatula test. So the cold spatula test is a clinical test for diagnosis of deviated nasal septum or any kind of nasal obstruction, where a patient is asked to blow air on this instrument so that there is fogging of the instrument. Now when there is a nasal obstruction, most commonly due to a deviated nasal septum, the amount of fogging caused by air coming out of one nostril is significantly lesser than the air coming out from the other nostril. Only then we can consider that there is some kind of obstruction in that nostril. I have explained the cold spatula test in details in my video on deviated nasal septum. If you want any reference, you can check that video as well. So this is lax tongue depressor. Then coming to the Mollison self-retaining hemostatic mastoid retractor. Now this instrument is used in tympanoplasty as well as mastoidectomy operations. I had discussed this instrument in detail in the tympanoplasty video. So if you want to learn in this instrument in way more detail, then please refer to that video. So this is the Lux forceps. So this Lux forceps is mainly used in septoplasty and submucosal resection operations, but this is actually an instrument which should be present with every ENT surgeon, because it can be used to take punch biopsies from oral cavities, from nasal masses, and it is also an important instrument while performing functional endoscopic sinus surgery for removal of polyps or diseased mucosa. This is the Tilly's nasal dressing forceps. Now the important thing to remember about this forceps is that you should be able to differentiate it from a Hartmann's forceps. So both of these instruments look similar, they do not have a catch, and the point in which differentiates a Hartmann from the Tilly is that, as you can see, there are very small serrations in one end of a Tilly's forceps, and the instrument is blunt. However, the Hartmann's forceps will have a tooth at its end and it is very sharp. So this Tilly's nasal dressing forceps is primarily used for anterior nasal packing. Rarely they may be used for removal of foreign bodies from nose or even the ear canal. But however, for that purpose, nasal foreign body is preferred for removal of a foreign body from nose, and Jobson-Horn's probe is preferred for removal of foreign body from the ear canal. So this is the indirect laryngoscopy mirror. This instrument is used to perform indirect laryngoscopy. How to perform an indirect laryngoscopy I will discuss in a later video. So this is whenever you are given this instrument, you are always asked what structures you can see by indirect laryngoscopy. So it is important to memorize those structures. Now this is a Thudicum nasal speculum. Now this is a very commonly asked instrument, and most of the students fail in properly holding this instrument. So I'll show you a proper technique to hold this instrument. You should always remember that these two blades that will go into the external layers of the patient should always point away from you, that is, they will point towards the patient. So the index finger will go into the U loop and the middle finger will go into the one limb, and the ring finger will come and hold the other limb, and with the thumb will support. So this is how, see, the blades which will go into the external layers are pointing towards the patient. So with the middle finger we will press the loop on our ring finger so that this the blades come together. Then we'll insert this in the external layers and we'll open it up. So that will open up the external layers. So this is mainly used for anterior rhinoscopy and also for introduction of anterior nasal packing for nasal surgeries like septoplasty as well as submucosal resection operation. Now coming to the last two instruments, this is a cuffed tracheostomy tube. How will you know this is a cuffed tube? As you can see, there is a balloon at one end and this balloon can be inflated. So what is the function of a cuffed tracheostomy tube? It is whenever we put in some air through this balloon, this part of the tube will get inflated. So how does it help? It helps to reduce the pharyngeal secretions from going into the trachea, and also it prevents air leak, that is, it can create a closed system. So whenever the patient is unconscious or needs mechanical ventilation, it is preferable to use the cuffed tracheostomy tube. And another important function of this tube is that it is self-retaining, that the tube will not get dislodged from the tracheostoma, as this balloon will prevent it from getting extruded from the trachea because this balloon has been inflated. Now it is important to remember we cannot keep the balloon inflated for long because it may induce tracheal necrosis. So it is all preferable that after every 2 hours we have to deflate the tube for 5 minutes, then we can inflate it again, because it may initiate pressure necrosis of the trachea. Now this is a tracheal dilator. This is used during tracheostomy operation. For example, when we are making the tracheostoma, if the tracheostoma is too small and it is difficult to introduce the tracheostomy tube to the stoma, we can put in this instrument into the tracheostoma and pull. So as you can see, the end widens, so it will be easier to put in the tracheostomy tube through the stoma. Now this is not only used during tracheostomy operation, even post-operatively when we are changing tracheostomy tubes, this is a very important instrument, and it is always important to keep this instrument nearby whenever you are changing a tracheostomy tube. So these are few of the commonly asked instruments. I will come in another video with more instruments, and hopefully this will help you for proper preparation during your viva examinations.